I'm Matt Willis, Marin County Public Health Officer, with an update on something other than COVID-19. We've been getting questions about the multi-country outbreak of monkeypox and what that might mean for us in Marin. I'd like to address this issue briefly and offer some comparisons to the much more familiar virus causing COVID. To start with, on a scale of 1 to 10, in terms of how concerned I am as an epidemiologist and health officer, with 10 being a global threat like COVID-19, I would put monkeypox at around a level 2 or 3. Something to be aware of as a community, but not overly worried about at this point. Still, we're monitoring the situation closely, and here's the current status. On May 18, 2022, a U.S. resident tested positive for monkeypox after returning from Canada. As of May 24th, there are now 5 probable cases of monkeypox in the U.S., including a possible case in Sacramento, and about 200 cases globally. I won't be surprised to see a few isolated cases regionally soon, mostly probably related to travel, but we don't expect to see significant global or local spread like we saw with COVID-19. The most important difference between SARS-CoV-2, the virus that causes COVID-19, and orthopox, the virus that causes monkeypox, is the mode of transmission, that is, how you become infected. We know too well COVID-19 is very easily spread through the air. Monkeypox, by contrast, is mainly spread through direct contact with bodily fluids or sores from someone who's sick. Picture the rash of chickenpox or smallpox. These characteristic dots are called pox, and they're packed with virus. That's why people with that rash should be isolated to contain spread. Unlike COVID, you can generally tell who's most infectious by looking at them because the rash is visibly obvious. Items that have been contaminated with fluids from sores, like clothing or bedding, can also be infectious. Rarely, with monkeypox, transmission can occur through respiratory droplets, following prolonged face-to-face contact with someone with the rash, especially if they have pox in their mouth. The reason global reports are saying it's looking like sexually transmitted disease, like monkeypox is a sexually transmitted disease, is probably just because people are being infected through close skin contact with someone with the rash. Monkeypox has also been around a long time. It's not novel like COVID, so we know a lot about it. We know it's usually limited to Central Africa, where the virus lives in local animal populations and sometimes infects local people there. We have examples of endemic diseases like that here. In Marin, think of Lyme disease and deer and ticks, or rabies and bats, or West Nile virus and birds. Diseases that are endemic to our area because they live in animals around us as an ongoing source of potential infection. Because we don't have animals that harbor monkeypox virus here, when case clusters flare up in humans, they tend to fizzle out pretty quickly, because it's not easily transmitted between people and the virus runs out of potential hosts. So those are some of the epidemiologic reasons it's too early to be alarmed. Still, we're following this closely. Monkeypox typically begins with flu-like illness and swelling of the lymph nodes and progresses to a rash on the face and body. Most infections last 2 to 4 weeks. The fatality rate for the currently circulating strain is about 1%. You should seek medical care if you develop a new, unexplained skin rash with or without fever and chills, especially if you've recently traveled to Central Africa, or if you've had close physical contact with someone while they are symptomatic with a characteristic rash. Today, Marin County Public Health issued an advisory to our medical providers throughout Marin, updating them on the current status of the monkeypox outbreak and offering a refresher on what monkeypox looks like and how to manage and report any potential cases to public health. Our goal is to identify and intervene as early as possible in any potential case to interrupt chains of transmission. We've also established a web page on our website dedicated to this issue as a place to post relevant global, national, or local updates at marinhhs.org/monkeypox. COVID-19 and monkeypox are just 2 of the many pathogens Public Health Department monitors year-round. Our primary focus now remains COVID-19, and we will continue to provide relevant updates on this and any potential threat to our health as a community.